Go. Dr. Said Shannat, how are you today?
Fine, thank you.
So you're the director of the
Finance and Administration and
of the
Palestine Hospital in Cairo, and I'm supposed to be in charge of the development and restructuring project here, which I hope will be one day in action.
So what exactly does this hospital do, the Palestine Red Crescent Society here in Cairo?
The Palestine Hospital is owned by the Palestine Red Crescent Society, which is a non-government activity, like the Red Cross everywhere, and it's a member of that. But it is, the Palestine Hospital itself is financially independent, tries to manage its activities here in Cairo. It treats Palestinians who are transferred mainly from Gaza Strip for medical treatment, which is missing there. So we try to treat them. We have treated lots of the injured Palestinians on the last attack on Gaza. We try to do our duty. We also treat Palestinians here who are, I would say, they do not have income, and we consider them as refugees. We cannot treat them as we want, but sometimes we are faced with this human suffering. We try to handle it, but as I would say, we cannot handle all or treat all. We pick some cases, try to help them. We sometimes look for donations in order to cover such treatment. These people are a special case in Egypt because they are not in Egypt, is not on the refugee map of Palestinians. People talk about refugees in Jordan, people talk about Palestinian refugees in Lebanon and Syria, because they are in big numbers. Now the people here are a different status because nobody asks, are there any refugees? But they are, I would say, suffering more than refugees themselves because they do not have any medical coverage or any medical treatment, and they have to find their own way to live. And this is one of the major problems I personally feel we'll have to address, because these people are income-wise. Some of them are not allowed to work, for example. They do not have work permit. Some of them, or most of them, are, I would say, old men who do not have income, and they cannot get free medical treatment. They do not have social insurance to cover them. PLO never asked about them. Palestinian presidency never asked about them. And of course, the Egyptian governments would not cover, I would say, residents medically. They would never cover them. So we are faced with this problem, and this I feel, because I'm staying in Egypt right now, I feel this is one of the most major problems. I have addressed the presidency, Palestinian presidency in Ramallah, requesting them, please, just handle this as if you are handling the other refugee countries, other countries with refugees here. Send us some money in order to give the medical treatment. Nobody cares.
How about UNRWA, United Nations? Are they?
No, they
don't operate here.
They have nothing. They have no existence here.
Wow.
No, in Egypt, no. Zero existence. UNRWA. They do not have in Egypt. You can check.
Yeah.
They concentrate in Gaza, on the West Bank, on Syria, where you have bulk of refugees. Here, nobody, go back to the history, nobody said any word about having refugees in Egypt, because it's not mentioned.
And there's about 100,000, some people are telling me?
There are. I cannot consider them as refugees, but they are Palestinians, and they are staying in Egypt, and they are suffering same like other refugees. I would say maybe in other countries the refugees are having they are being treated like the citizens of the same country, but here they are not. They will have to find their own way in order to get medicine. They will have to pay for it. I have addressed the presidency. I have addressed everybody and said, this will at least, if I have an amount of money that covers at least even the retired people. I don't care for the younger people, the retired people. At least when I give them medical treatment. At least I can help. This hospital was established more than 25 years ago, and the equipment are still 25 years ago.
And the entire hospital?
They are the same. We have some East German X-rays still. East Germany is gone, but we are not.
And our equipment's still here.
We are not. We need lots of things, but as I said, I mean, we do not have the luxury to say, get us all what we need. Get us anything that helps in treating people. We don't want any money.
I'm going to take a tour of the hospital later, but specifically, like what issues are particularly facing the hospital, or what need to be addressed in the hospital? I noticed the elevators don't work, the lifts don't work.
Listen to me. If we go to the infrastructure, for your information, since 25 years nothing was done with regard to the infrastructure. We now have, I mean, the summer is coming in a month's time. We have the AC, major part of the AC is, the central AC is down. We have calculated and have checked repairing it. It's more than $120,000 for the repair. Of course, we will not dream of having this $120,000. We said, okay, if we do not get it, let us get something like 40 or 50 split units, smaller units, which is about $40,000 to put them if we cannot. But this is an plan B if we do not get that. I have addressed some of the Palestinians, rich Palestinians, and told them, okay, if you want to help, we are never interested in cash. We just ask you, send your engineer, send somebody, watch it, see it, decide. If you want addresses, we'll give you addresses. If you want names, we'll give you names. If you do it your own, we would like to be as transparent as much as we can, and we will not get any money. We just want this hospital to perform with the minimum that it can give a service to the Palestinians here in Egypt and the Palestinians coming from Gaza. For your information, we have treated something like more than 70 of the injured during the attack on Gaza. It costed us more than $120,000. Nobody paid any money. Luckily, thank God, we have got some donations, which was about $40,000, but we still have a deficit of whatever, $80,000. Nobody cared. Even the Palestinians, the Palestinian presidency didn't pay. The Palestinian health ministry didn't pay. Even the Palestinian Red Crescent didn't pay. We are left here even without the ability or the luxury of having our salaries by the end of the month. We don't care about the salaries, but we care how to continue performing with a minimum. Okay.
Well, thank you very much. Appreciate that.
Thank you.